Dr. Michael Fine is joining us, not only give some perspective on what's happening with the coronavirus, but also what's happening in the political sphere. Dr. Fine was a candidate for public office not too long ago, about 2 years ago at this time. So let's talk about the coronavirus and what's happening out there in the rest of the world. And then we'll get to Rhode Island in a second. But what's happening out there in the United States with COVID-19?
We've had a huge failure in the United States, a public health failure, the likes of which we've never seen. The coronavirus, when you understand it as a virus, is one of a group of 5 viruses now. It's a new one, but they cause colds. This is not a devastating virus like Ebola, which kills 50 to 75% of the people who get it. This is a relatively mild virus for most people, but it can be lethal for some. And all we needed to do to contain it was to prevent it from spreading in the United States, which many other countries were able to do. And we failed to do that. And that is a judgment on us. That is evidence that there is something wrong in Denmark, except it's the United States. We have not been able to function as a people and defend ourselves and each other. And for that, I think we all ought to be ashamed.
You know, being ashamed is one thing, but taking action is another. How have we managed this virus, this disease, in our neck of the woods in Rhode Island?
We've done relatively well in Rhode Island, but relatively well means as of today, we've had 1,071 deaths. This is the 11th of September. And we've had 22,000 people who have been tested and are positive. We haven't had, 3 times that number of deaths, but we are still, I haven't seen the comparative numbers lately, but we're still 5th or 6th in the nation for the percent of deaths as a proportion of the population. And a lot of that has to do with the fact the virus spread more than we wanted it to. And a lot of it has to do with the fact that Rhode Island is home to the largest number of old people over 85 in the nation. But given all those constraints, we didn't see our hospitals overflowing and didn't lose people because there weren't enough hospital beds or respirators. And that's a good thing. But we did have a fairly sustained shutdown, a shutdown that likely wouldn't have been needed anywhere near as long as we had it if we had been able to implement the kinds of things that other countries did well.
And one of those things doing well was taking some political action. And you ran 2 years ago. What do you remember why you ran 2 years ago?
Well, I ran 2 years ago because I thought it would be wise to have someone who had a little public health and health policy experience inside the legislature. We didn't have that, and the legislature didn't really have much action during this time. During the time of COVID, the legislature kind of shut down and disappeared, and the governor did everything. So I don't know whether if I had been in the legislature, we would have seen any difference. I suspect not. But, for better, for worse, we did reasonably well, and that was a good thing.
So getting into taking action, what can a political candidate do this time around? You just said the legislature's been inactive. In my field, in the environmental field, it's been not only inactive, but at times it's taken giant step backwards in terms of environmental action. So what kind of political action can candidates do, especially during this time, during the COVID-19 time?
I have long believed that we ought to be working on a healthcare system that provides primary care to all Rhode Islanders. And there's lots the legislature can do to make that happen. There was proposed for the legislature, and you and I met actually over a discussion about this, something called the Rhode Island Primary Care Trust legislation. We could pass that, and that would get everyone primary care and strengthen the primary care system. It's not clear what's going to happen to primary care in Rhode Island over the next 6 months, but it is hurting. And we, I suspect, will lose some very important primary care practices, and people have lost the ability to have and maintain a relationship with the primary care doctor other than over the phone. So the first thing from my perspective is to pass the Rhode Island Primary Care Trust legislation. Second thing I think we ought to do is start setting hospital prices. So there's a single set of hospitals that's been done well in Maryland and now West Virginia, so that hospitals can't charge whatever they want for everybody, that we have basically a cap on what hospitals can charge. Third thing I think we ought to do is require much more public participation in the appointment of hospital boards and healthcare center boards. Any board dealing with public money ought to be governed by people who are publicly elected, instead of being privately appointed in ways that tend to serve the senior executive staff of those institutions before they serve the public. So those are three really simple things that the legislature could do. A fourth one would be to give the director of the Department of Health a checkoff on community benefit reporting. Now that's pretty twitchy and policy wonkish, and I won't spend a lot of time on it. But right now, hospitals are free to say whatever they want and claim whatever they want for community benefits to justify their nonprofit status, and that's something the legislature could easily change.
What does it take for a candidate or somebody in office to actually make those 3-4 things happen? Does it take will? Does it take numbers? What does it take? What does it take to get things done?
Well, practically, they say healthcare is the fourth rail of politics because there's so much money in it that people who oppose the change have the ability to bring to the table a significant lobbying presence. So I think what it takes for candidates is to have the discussion and awaken people's interest so that we get a widespread discussion in Rhode Island about what we need to do. And so that when people in the legislature try to affect change, it's not stopped by people with something to sell. But what I know is about you as a person and your commitment and leadership over many years, particularly in the environmental world, but also thinking about Rhode Island politics in general. I mean, you are the person who cannot be bought or bossed. And that makes you exceptional and important just by itself, because that means that special interest money, and as you have lots of experience with when it comes to the environment, when it comes to healthcare, comes to education, that special interest money is all over the place in the legislature. And if you can make choices for, and you will, as you make choices for your constituents instead of for people with money, that moves everybody's agenda forward and moves it powerful. And you also have the ability to be out in the community and to be there listening and stimulating public discussion. And let me tell you, for healthcare is not changing until we all get engaged and build a little movement to change it. And I think you as a person are ideally situated to help make that happen.
Michael, thank you so much. It's always a pleasure chatting with you and hope to see you again. Thank you.